Hi, my name's Maria and I'm here to talk about my 3-day practicum. I chose to do it at a free clinic called Clínica Latina. As you can tell by the name, it mostly serves the underserved Hispanic population. Generally, the clinic is only open a limited number of times during the month, so the times that I would go to clinic, there would be a line of patients outside the door, so it was really busy and it kept me on my feet the entire time. Some of the things that we would generally see is a lot of diabetes patients there to get their refills, a lot of asthma, people using their albuterol inhaler like 10 times a day because they couldn't afford the combined inhalers, or things like birth control were really common. I think what was most surprising to me is that a lot of the patients used the clinic as their primary care, and a lot of it was for issues that they really needed to be handled by somebody who saw them on a more regular basis rather than sporadically whenever the clinic was open and they happened to be first in line and they got a spot in the clinic. That's something that we really tried to work with the patients and enforce and try to circumvent and maybe give them prescriptions for a little longer so that they could hold out until the next time the clinic was open. But the little that we could do with the resources that we had to offer them, I think it really went a long way for them. It was just, for me, I think the hardest part was just trying to work around it, but I was happy to have learned how to do it there. And something that was most surprising for me is that working with these patients, I felt like I could really connect with them, and they a lot of times would come with maybe misconceptions about their disease process, and it was something that wasn't too far out for me to really understand because it's things that I grew up listening, my relatives say, like things related to the hot and cold theory and things like that. So I was happy to be there to not only relate to them and tell them, acknowledge what they're saying and understand where they're coming from, and at the same time be able to educate them on why they're sick or what treatments they should seek or when they should come into the hospital. So I think I really appreciated the educational aspect of the clinic and having that kind of unique standpoint of being Hispanic but then also being in the medical profession. Overall, I loved my 3-day practicum. I'm happy that I was able to do it and that I was able to tell you guys about it.